There's no way to take care of really sick kids who don't have problems that follow a flow chart and not disagree with each other. And so that is not only expected, but it's appreciated. And we seem to be able to take that conflict and move it forward so that the kids are moving forward. And I think that that's a really rare skill set. And I think it's a really important one to start to see during training so that you know how to be a grown-up when you're off on your own. My name is Mary McBride. I'm a pediatric cardiac intensivist. So I work in the cardiac intensive care unit here at Lurie Children's. And I'm the program director for the Cardiac Critical Care Fellowship. So it's an advanced fellowship for trainees who've already completed either pediatric cardiology or pediatric critical care medicine fellowships. The Heart Center here at Lurie Children's is a very busy program. We're one of the busiest places in the state of Illinois that takes care of children and adults with congenital heart disease. We are the only site in the state of Illinois that takes care of and performs heart transplantations in kids. We're very fortunate to have the talented surgical team, the talented nursing team, and we have a pretty unique cardiac critical care team too. There are 12 of us who've come from varying institutions, and there's lots of different paths that get people to being a fully trained cardiac intensivist, and we have people that have taken multiple different types of those paths. And I think that puts us in a really unique situation in terms of the types of learners we can really help blossom. So we're pretty excited about that. We have a cardiac care unit that is very unique in the way that we provide care. And the way that it's unique is that we're trying to house all the kids with heart disease at Lurie Children's under one roof in one unit. It's an admission to discharge unit. So the kids, in theory, get admitted to one bed space and then they stay there throughout their stay. We do it that way because the families feel less disjointed and bounce around less, and they get very comfortable with where they are in time and space in that unit. And the benefits, as I see it, is that cardiac kids can decompensate even when we think they're getting ready to go home. And so what I value in it the most, aside from the really awesome nursing staff, is that when those kids who we're not expecting to go bump in the night do that, then I'm right around the corner and me and my team can come help them as quickly as possible. And I think that that improves our outcomes. It's very busy, and there's just a certain volume, a critical volume that you have to see in order to be competent at what you're doing when you graduate. And so we're busy enough for that to happen. We are physically connected to Prentice, which is the place where all the babies are born, which is really important for people who take care of newborn babies with critical heart disease. The bridge connects right from the delivery hospital to our cath lab. So we can get kids immediately into the cath lab and have life-saving interventions, and then they get moved up to the 22nd floor, which is where the cardiac intensive care unit is. Another benefit is across the street is the rest of Northwestern Medicine Hospital, where our adult congenital patients are either seen through the Lurie Children's system specifically or within the Northwestern system. So we're able to take care of all of our patients right here on one campus in 3 buildings that are super close, if not physically connected to each other. And it just makes for better care and for a better learning place. And then additionally, Streeterville is where the hospitals are all housed, and it is beautiful. It's on the lakefront. If you have a bad day and you use retail therapy as your strategy of choice, then Michigan Avenue is right down the street, and I've certainly, made use of that convenience as well. Thank you for taking the time to listen, to hear about our program. Please don't hesitate to reach out. Should you have any questions or concerns, I'd be happy to address any of those by email.